Welcome to Ali Fitness Podcast, a weekly production all about bringing health into fitness. Dr. Larry Creswell, MD, is an adult heart surgeon at the University of Mississippi Medical Center in Jackson, Mississippi. He cares for patients who need operations such as coronary artery bypass surgery, heart valve repair or replacement, repair of aortic aneurysm, and heart transplants. He's a triathlete and a long-distance swimmer, and I believe he's got an eye on the English Channel swim in 2019. He has an interest in sports cardiology, generally and particularly the heart problems of recreational athletes. You can follow Dr. Creswell on Twitter at athletes.Heart or at his blog at www.athleteheart.org, and I'll put those in the show notes. But firstly, Dr. Larry, thank you for coming on.
Well, thanks so much for having me, Ali.
I'm excited. I reached out to you because I know you're an athlete yourself and you specialize in helping recreational athletes with heart issues. And I mentioned to you offline that I've had a couple of close friends recently who are pretty hardcore athletes who have had heart conditions. So I can't wait to get into this. But firstly, can you just share your story about how you became a healthy fitness
Sure, Ali. I was a swimmer growing up as a kid. That was my main athletic interest, I would say. And that came to an end when I headed off to college or university. And I was more or less sedentary for the period of life which involved college and medical school and residency training. And maybe when I was about 40 years old, I decided to pick back up and to be more active and restarted my swimming and became friends with people who were cycling and running, and eventually triathlon became an interest and has been an interest for maybe the last 15 years. But like you said, these last few years, I've taken an interest on longer distance swimming and working my way, as you said, toward an English Channel swim next year. That's the fitness part of things, I suppose. In terms of the interest in the heart has always been an intriguing organ to me. It was true from the beginning of medical school, and I settled eventually on a career in adult heart surgery. It's interesting to hear you talk about friends who have recently had troubles with heart problems. It was my observation as I got back into swimming and running and then cycling and the sort, that even just in a relatively small group here at home who I was doing those things with, people would always have questions about their own heart health or would be willing to share stories about friends who had troubles with their heart, in spite of seemingly being very healthy and very fit. And so that was really the genesis of my interest in heart problems among recreational athletes. It sort of bridges the professional side of my life and the recreational side. And I'm happy to lend an ear and try to provide some help where I can.
Awesome. And so before we get into that, can you tell us a bit about what your training looks like, especially leading up to the English Channel swim?
So the English Channel swim has been 2 years in the making already, and I have another year to go with the swim planned for September of next year. It takes almost 3 years as a cycle to lead up to it because one must schedule or book a pilot boat 3 years in advance for the swim. And so 2 years ago, I shifted direction a little bit from primary focus in triathlon to one that has involved more and more swimming. And this past season, I've done no triathlons. I've done running and cycling as part of, I'll say, cross training now. But now it looks like swimming on 4 or 5 days a week and with a long swim on the weekend. I've taken advantage of traveling a bit to get to cold water, like the English Channel is here in the U.S. I commute to San Francisco to do swimming on the long weekends. Spent a number of weekends in the United Kingdom, not only at the English Channel but around the UK, where again there are swim venues where the water's the the right temperature for some long distance swimming. So next season will be more of the same, more of longer and longer training as best I can fit it into my schedule. And as I said, working up to the final swim the third week in September.
Wow. And what does the final swim look like? How long are we talking?
Well, the channel is 21 miles across, and sort of an average time for swimmers this past season was about 14 hours or so. So 14 hours in the water at about 60 degrees Fahrenheit or maybe 16 degrees centigrade, without a wetsuit, of course, and keep my fingers for good weather on the week that I'm ready to go.
Wow. I don't envy you, especially in that cold water. But how long would a weekend swim be then for you?
Oh, several hours.
Excellent. Great. Okay. So I'm really intrigued to know how common are fatalities at endurance sporting events because of it, like a hidden heart disease or something like that. Because it seems like, I don't know whether it's the media making it sound like it's common, or is it really common?
I'd say that it's uncommon, and maybe that can be a reassuring fact for your listeners here today. But it is startling, of course, when the media reports that someone seemingly healthy has died at a running event or cycling event, swimming event, triathlon. And it's really unsettling if you're there on the day. Perhaps you've been there or known people who've been there on the day when someone has died. Even in my relatively modest career of doing things like this, I've been there on several occasions where at a running race or at a triathlon, someone has died, and it's really sad, and as I say, startling or unsettling happening for sure. Because just as a bystander, you might look in and you see this seemingly healthy group of people out there doing their thing, running or swimming, and it's the truth that every so often, one of those seemingly healthy people can die suddenly, and it's almost always because of heart disease that has gone unrecognized.
So how do we recognize heart disease? What are the sort of warnings that we might become aware of?
Yeah, I think that is worth considering, Ali. In retrospect, when we look back at some of these people who've died at running, let's say endurance sports events, there have been clues. Families relate or friends relate that perhaps there had been clues to something wrong in the past. But I think that important warning signs of heart disease might be, let's gather together a group of 6 things that I might toss out. Maybe the most important would be chest pain or chest tightness or chest discomfort that occurs while you're exerting yourself, and that resolves when you sit back down. That would be one important warning sign. Another warning sign would be shortness of breath. Now, every athlete who does these endurance sports that we're talking about knows that shortness of breath is just part and parcel of doing it. But it's easy to become accustomed to what might be normal in terms of that shortness of breath. But when that shortness of breath is unusual or out of proportion to the way it ordinarily has been, that might be an important warning sign. Another warning sign might be palpitations, we call them, a pounding in the chest that usually comes with some abnormal heartbeat. That would be worth getting checked out.
And Dr. Larry, sorry to interrupt there. Would the palpitations be just during the exercise or potentially while they're not exercising?
No, it could be either way. That's a good point, Ali. I think that can happen even just sitting down before or after exercise or any old time, to be honest. That needn't be just while one was exercising. Everyone will know that their heart rate goes up while they exercise. I'm not talking about that, but I'm talking about something that is really different, and a pounding or an unsettling feeling in the chest of a heart rate that's run amok, if that makes sense. Maybe another warning sign would be light-headedness or even blacking out, and particularly while you're exercising. Maybe your listeners will know the feeling of getting to the end of a long run and feeling lightheaded and sitting down. That's not what I'm talking about. But I'm talking about really having lightheadedness to the point of nearly blacking out while you're exercising, whatever form that would be, running, cycling, swimming. That's a really worrisome sign. Fatigue is another warning sign. We all get tired when we run or cycle and the sort, but you become, again, accustomed to what normal fatigue is. But when there's an abnormal fatigue that's unusual or persists for too long or just out of proportion to the exercise that you've done, that might be another warning sign. And then the last thing I'd toss out would be, particularly for your listeners who are competitors in one of these sporting areas, that there would be some sort of decrease in their performance, their ability to go fast or to go long. That really doesn't have a good explanation, perhaps in terms of the training they've done or injuries or sickness and the like. A decrease in performance is another warning sign that something could be wrong. I would say that those are 6 useful warning signs, Allie. And I think that in many circumstances when athletes have died at competitions, there are people around them who could look back and say that there was mention made of one or more of these warning signs. And it would be that, and on the flip side, of course, that would be the opportunity to try to head off a problem for yourself.
That's great. And I do want to talk to you more about the opportunity, but just one other question I had around that. A lot of our athletes actually, our listeners, do actually track their HRV. Would that help in any way by perhaps indicating that there could be some sort of issue with the heart?
That's interesting. Heart rate variability is a measurement tool, I guess, that's been around for, 3 decades now. In the end, it's found very little use in clinical medicine generally. I know that there's been a bit of a resurgence in interest in using it to characterize training cycles or preparedness or the body's readiness to train. But I don't know about what link we might find with heart rate variability and then later heart problems that were serious or even fatal. The one thing that comes to mind as I think about heart rate variability is that for athletes who track their heart rate variability, they might very well stumble across episodes where the heart rate is abnormally high while they're not exercising. That might be a clue that there is an arrhythmia that comes, perhaps a benign, I'll call it, arrhythmia that comes that you might not be aware of if you weren't so closely tracking the heart rate.
I'm glad you brought up arrhythmia because I know a lot of people who do have that issue. Can you briefly explain what is a heart arrhythmia and what are the signs and how you can sort of treat that?
Sure. The heart comes with a pretty nifty electrical system that is designed to last a lifetime, where with each heartbeat there is an electrical activity that causes the heart to squeeze its chambers in the right succession to get the blood pumped in an efficient manner. The heart's interesting because it generates this electricity all by itself in like its own built-in pacemaker, let's say. But whenever the electrical activity is not organized the way it was built in and meant to go, we might say that there is an arrhythmia. Now, the 2 commonest arrhythmias would be that there's normal electricity, but the heart goes too slow. We call that bradycardia, slower than 60 beats a minute. Or when the electrical activity is organized correctly, but the heart beats at more than 100 beats per minute, we call that a tachycardia. And so everyone who's a trained endurance athlete will have both of those arrhythmias, both bradycardia and tachycardia, and we call them sinus bradycardia and sinus tachycardia because the electrical activity is organized in its ordinary way as just part and parcel of their day. People who exercise a lot will have a slow heart rate at rest, which is quite normal, even though we say you have the arrhythmia called sinus bradycardia because the heart is beating at less than 60 beats a minute. And when anyone exercises, I'll say most of your listeners will have a heart rate that's greater than 100, and they will have what's called a sinus tachycardia. And all of those are normal arrhythmias, let's say. But there's a whole basket full of other ways that the electrical activity of the heart can become disorganized. The most common way is an arrhythmia called atrial fibrillation. It's where the upper chambers of the heart have a very disorganized electrical activity and no longer has the proper relationship with the electrical activity in the pumping chambers of the heart. And that's a situation called atrial fibrillation. And many athletes turn out to have that. It's an arrhythmia that occurs in 1 out of 4 men and 1 out of 4 women over a lifetime in the general population. But we've come to learn that it may be several times more common among endurance athletes after some time. And so there are many, and that arrhythmia can come and go, or it may be there permanently. But there are a whole, like I said, a basket full of arrhythmias, and we say that's the case whenever the electrical activity is not normal. I hope that makes sense. It's maybe a lot to take in.
So you said it's more common with endurance athletes than the average person. So is that because of do we know that why that is?
I think it's because of the exercise. The heart responds to exercise by growing. It grows because you're asking it to do more work than it would otherwise. And one of the consequences is that the upper chambers of the heart that hold the blood before it is pumped grow. And the larger this reservoir chamber, the upper chamber, the atrium on the left side of the heart grows in size, the more likely it is that someone will have disorganized electrical activity in that chamber that we call atrial fibrillation. In some studies, it is perhaps 6-fold more common in endurance athletes than among people who are sitting on the couch. And I'd say that we generally think of atrial fibrillation as being a benign problem and that it doesn't ordinarily have consequences that are too bad, but there is a small risk of having stroke if you have that. And there is the problem that with atrial fibrillation, the upper chambers and lower chambers of the heart don't work in conjunction like they were meant to. And athletes will not get the best efficiency from their heart and will be limited in some sort of way at the top end of their performance.
So presumably then someone with that condition could have a heart issue if they push themselves in an event?
That is true. There are people for whom this arrhythmia will occur during exercise, like you say, and can come on and go away even in the course of a bike ride or a run, a swim, sure.
So as a doctor, would you suggest that they didn't exercise to where their heart rate was going high?
No. I wouldn't want to say that. I'm one who would encourage exercise for almost everyone, but atrial fibrillation is one of those things where an athlete can choose to live with it. Maybe an aspirin or blood thinner is prescribed if there's reason to think that their stroke risk might be high, but one might take medicine to make it come less often or be less severe when it does come, or one might choose to have what's called an ablation procedure, even where a catheter can be used and threaded up inside the heart and try to find the area where the electrical activity is becoming jumbled, and then use energy to zap the area and try to prevent the atrial fibrillation from coming back again. So there are a number of ways to go about working on that. But there are certainly many athletes out there who have atrial fibrillation and just put up with it, even if it is a nuisance at times when they go to train or go to compete, and it occurs while they're wanting to seriously do one or the other of those things.
Interesting. So you mentioned the 6 warning signs, which I think will be really beneficial for people to keep an eye on. Is there much of a difference between ages and sexes when it comes to those warnings?
Perhaps. maybe.
For example, I've heard, and I could be wrong, that women don't necessarily have that same sort of chest pain.
That's right. I think that would be, of those 6 warning signs, that would probably be the warning sign that might be most different between the sexes. So as you mentioned, it's important for women to remember that the warning signs of heart attack or problems with coronary artery disease, which is blockages in the coronary arteries that bring blood flow to the heart that cause heart attack, are sometimes different than they are for men in the ways you described. The classic symptom for men is the crushing pain right in the middle of the chest, like the elephant is standing on your chest, might be the classic description. For women, it may be different from that. For women, it can be a more subtle feeling that's not pain, but maybe tightness or just a feeling of doom, maybe. So I think that the symptoms can be different, but the warning up in that category, the warning sign is still equally important for men and women, maybe.
Okay. And so let's say some of our listeners are experiencing some of these warning signs. What would be the best, I guess, steps to take?
Well, I think that so let's focus on a group of people. Maybe your listeners would be a good group that are already out there exercising. Okay, so they've been going at this and there have been no symptoms, but they come across one of these 6 warning signs. That would be a time to pause and think to visit the doctor and to have discussion with their doctor about the symptoms and what, if any, significance they might have. It's different for the group of people who are perhaps sitting on the couch and thinking about getting off the couch and going to exercise. But for the group of people who are already exercising, not having any symptoms, and then develop one of these 6 warning signs, I think it would be worthwhile to visit the doctor to get sorted out.
And then I've heard there's a lot of different sort of tests that they do. Are there any that you would recommend not doing versus doing?
Right. There are, there's an endless array of tests that might be useful in the athlete population. I think that athletes could be, I'm thinking about the recreational athlete in midlife who is a runner, let's say. I think that person would do themselves well to visit the doctor at the start of each year or season, where they have the opportunity to talk with the doctor about anything that's on their mind, but particularly any symptoms related to running, cycling, whatever they're doing, and have a physical examination where the doctor looks and listens at things. And after that alone, after physical exam and conversation with the doctor, reach some judgment about if any other testing would be needed. For the person who has no symptoms and is exercising and no warning signs, like I've mentioned before, that maybe no other testing would be needed. But in a general sort of way, I like the idea of maybe at one point in one's life having an EKG, an electrocardiogram, to make sure that the electrical activity in the heart is normal. It takes 5 minutes to have that test done. It's relatively inexpensive. It can identify some of the inherited problems that affect the electrical activity of the heart that sometimes don't manifest until adulthood. And I think that would be a good one-time test to do. I think another one-time test that could be worth doing is called echocardiogram, an ultrasound test of the heart. Much like the way a pregnant woman would have the ultrasound test to look at the baby, the magic wand of ultrasound can be used to look at the heart as it's beating in the chest. And again, as a one-time test to make sure that the heart is structurally normal, that there are no congenital or inborn problems that relate to the structure of the heart. The heart valves are all there. The chambers are all there. There are no holes between the chambers of the heart. There are no extra pieces and the like. Could also be a useful one-time test. For people who develop any of those warning signs that I talked about before, there may be very specific avenues of investigation that would flow from a description of symptoms of one or the other of those warning signs. Those are a few thoughts that come to mind. I think it's easy to, or it's hard to generalize, and I do think that because it's hard to generalize, maybe the best way to get an individual locked into some useful scheme is to have a way to visit the doctor maybe once a year, even if you're healthy completely otherwise, as a starting point where someone can individualize their thoughts and any investigation for you particularly.
That's helpful. And then what do you think about calcification around the heart and athletes?
Right. So we're maybe the human being is just born with the problem that as decades go by, many people develop plaque that becomes calcified in the coronary arteries, these arteries that bring blood flow to the heart and are the arteries that are responsible for a heart attack. It is more common in men than in women. It's more common as we get older than when we are younger. But even 20-year-olds can have the problem of calcium buildup and plaque buildup in these arteries, and that's why it's so important to keep track of the warning sign of chest pain and discomfort and the like. But I think that's almost a part of the human nature, I think.
And would you say there's any correlation then between athletes and that calcification? I've read several different studies saying that an athlete's actually more likely to build up that calcification. Is that true?
It may be true. It's an area of investigation now. One of the things is that maybe athletes get more calcium in these coronary arteries, but they also have the positive finding, though, that their arteries become larger because of having exercised. And so you can imagine that the same amount of calcium in a small artery would be a bigger problem than the same amount of calcium in a much bigger artery or bigger pipe, might be the way you think about it. And so it's not really clear that there's any consequence that comes of athletes being more likely to have calcium buildup than non-athletes. I don't think that should worry your listeners at this point.
Great. That's very reassuring. So what can an athlete do then to prevent these heart issues?
Well, I think that exercise is one of the things that's good for preventing heart problems in a general sort of way. And so while we've talked about sensational headlines when athletes die at events, or when you might hear that an athlete friend has developed a heart problem, that shouldn't keep people from exercising. I think that exercising and eating right are the two things that are not smoking, maybe would be the third things that athletes can do, but everyone should do to try to prevent heart problems. I think that being honest about the warning signs that we've talked about would be another important strategy, and seeking help when there's reason to be concerned that there is a heart problem. Sadly, we're born with the genes that we have, and some people are more likely than others to have troubles along the way. But again, I think by being tuned into your body like your listeners will be, and being honest about symptoms and seeking help, I think would all be the things to do.
And Dr. Larry, if you had a family history of heart disease, would that prompt you to start these tests a little earlier?
Yes, I think that you should keep that in mind. There are, and as I think about it, the important family history items to worry about would be a family history of early coronary artery disease. So this would be members in your family tree, particularly the parts of your family tree that are closest to the trunk. So your parents, your brothers or sisters, or your children have problems with heart attack at an early age in particular. That's one important part of the family history to be concerned about. Another part of the family history that doesn't get as much attention, but ought to among the athlete population, are situations where people in your family tree have died suddenly without explanation, or they have somewhere in your family tree, someone has learned that they have an inherited problem that causes people to die suddenly. What would those be? There is a condition called the long QT syndrome, for instance, that can be identified by electrocardiogram. But people with that problem just die suddenly because of a heart arrhythmia like we talked about before. Or there's a condition called hypertrophic cardiomyopathy, an inborn problem with the heart muscle itself, where in a family tree, if it happens once, it could easily happen somewhere else in the family tree. So those are three of the conditions I think that would be important to think about in terms of family history. But you should be aware of your family history to the extent that you can. And I think that it could take the help of a medical professional to help you understand what implication that might have for you. But I do think it's worthwhile keeping that in mind as you think about your heart health and your exercise ambitions.
Excellent. And so would you recommend to our listeners a particular diet if they were, I guess, firstly concentrating on the health of their heart? Are there particular foods that you would say would perhaps be detrimental, or particular foods that you would encourage them to eat?
Right. Diet is hard because you'll know that there's conflicting opinion and evidence in the news almost constantly in that regard. But here's what I could say. When you go to the bookstore, there are hundreds, thousands of books on diet, which might be the clue that no one diet is exactly right. Maybe is the way I think of it. And I think that each of those books has a prescription for diet that can be hard to adopt. Maybe the best thing I could toss out for your listeners would be to eat real food. And what do I mean by real food? So I mean the lean proteins, the fruits, the vegetables, and nothing that is processed. And maybe the easy way to think about that for a listener who's going to the grocery store is that you need to get your food from the outer ring of the supermarket, and almost everything in the middle of the supermarket is a processed food. So eat real foods. Don't eat anything that has more than 5 ingredients on the box. And I think if you did those couple things, you'd put yourself in good stead.
Excellent. So I guess I'm going to ask you more of a personal question just to get a real answer out of you.
Sure.
Because as we know, there's a lot of debate around meat and heart disease and what have you, and also around fat, good fats and what have you. And I guess also while we're on the subject, we may as well talk about salt. So I guess maybe if I position this to say, let's say you find out yourself you've got a heart disease or a heart issue, and I guess what in respect to those 3 foods would you change?
Okay, so we have meat, we have salt, and what was the third?
Fats.
Okay, there is an enduring debate about what would be the healthy fats to eat, and I don't know what to make of that. Every year it seems like we are coming across evidence that refutes what we thought was best the previous year even. And so I don't know if I have a prescription for what to do best with fats. For the meats, I think that any of the lean meats and proteins are okay. And salt is one of those things where the body would do best if the salt, or sodium we'll call it, intake was not excessive. The healthy body is pretty good about dealing with too much salt, but it would be best to limit one's excess or unnecessary salt or sodium. And so that means that you just don't at home have salt to add to the food, or you choose to season food with with something other than salt. There are many commercially available shakers with various spices other than salt that one might use as a substitute.
And sorry, just to clarify, Dr. Larry, are we talking about table salt, or are your thoughts the same when it comes to sea salts and other types of salt?
I would cast out the idea that it would be best not to add salt of any sort. I think it would be great to have no salt at home: sea salt, table salt, salt shaker, garlic salt, whatever it might be. I think it would be an easy prescription to adopt at home and would be healthy. But the biggest intake of salt, though, for most people occurs not that way, but in the food that they buy in the middle of the supermarket, like I was talking about before. So we're fortunate in this country that there is labeling that will include the salt content for the sodium content for various foods, and it doesn't take but one trip to the supermarket to realize that there is a lot of sodium in all of the processed foods in the middle of the supermarket. And for, as I say, for most people, that would probably be their biggest source of sodium intake.
Excellent. So it leads me to my last question, which I'm really fascinated to get your opinion on, because I personally have had a few experiences where I've been working out with someone and they've had a heart attack. One instance, I was in a boxing class, and a gentleman who regularly came to the class, I think he was in his late 40s, fairly reasonably fit guy, just dropped down, and straight away I knew it was a heart attack. I don't know exactly why, because I hadn't seen someone have a heart attack. And funnily enough, there was actually a dentist and a few other professionals in the crowd, but no one sort of put up their hand to do anything, and everyone sort of froze, including actually the gym instructor at the time who was leading the class sort of took a bit of control. But I immediately ran and actually got a defibrillator, because I knew that would be his best hope. And at the same time, got someone to start doing CPR. And long story short, he actually survived a major heart attack, and it was all because of the defibrillator. And we were told that the CPR alone obviously would not have actually helped in this case. What are your thoughts about how fellow athletes can help others in a situation like that? And are there any sort of tricks or qualifications or anything else that we should be thinking about?
Oh, those are great questions, Ali. I'll share also a similar story to yours. One of my heart surgery partners, number of years back, dropped dead on a hotel treadmill at one of our medical meetings, where he had gone to exercise, and there was no one around to tend to him, and he was just found dead at the treadmill. And so, a fit guy, a runner, long distance runner, and so it can happen. We're very vulnerable when we're alone like that, and it is great to hear the story that you described of saving someone's life, really because of the wisdom or the experience of the bystanders that were there that day. In your case, we really are safest when we are around people who can help us if that should happen. The gym is an interesting spot. It's a spot where exercise happens, and you'll know that in the last 10 years or 15 years, there's been a real effort to put defibrillators in automatic external defibrillators that can help provide a shock if a shock will restore the electrical activity of the heart as it needs to be. And they've been positioned in places like gyms, fitness centers, athletic centers, stadiums, where people come for the purpose of exercising. And I think that that's been a great thing, but it takes people who are knowledgeable about what cardiac arrest, we'll call it, looks like. Someone suddenly falls to the ground, is pulseless and is not breathing, unconscious. And the only way that someone like that survives is that someone recognizes that that's an emergency and provides CPR promptly, and also promptly gets a defibrillator if it's needed. Now, in the big city, your big city among them, the EMS, the emergency medical people, can respond within minutes to something like that. But that's not true everywhere.
Well, funnily enough, this was actually in the middle of Sydney, and it took 22 minutes for the ambulance to arrive.
Oh my heavens!
And the reason was because they were changing shifts. And I said to them, "Well, are you a Pizza Hut? Don't you have like some crossover?" But so I would dare say that it doesn't really matter where you are. You have to sort of be prepared. And I guess one thing that came out of that for me was that whenever I go anywhere in a public place, including a gym, I always look to find out where the closest defibrillators are at any time, so that I know that if that did happen, I would know exactly where to go. And another interesting thing that came out of that was that 6 months ago, they did a test on those defibrillators and none of them were updated. And so they recently, about I think 4 months before this incident, had updated them all. So thankfully that was the case. I wonder if that's the case elsewhere. But what are your thoughts about an athlete who trains with other athletes or an instructor making sure that their CPR is updated?
I think that's wise. I think it would be wise for everyone who's an exerciser or an athlete to learn CPR and to learn how to use the automatic external defibrillator. I can't think of why you shouldn't. Like I say, we're safest when we're amongst people who have those skills, and there'll come the day there'll come the day when you see it in action or need to help out. But
how effective do you think CPR really is? For example, in my example, there's no way he would have survived the 21 minutes without the defibrillator.
I think that's probably right. Sad to say that if we looked broadly in this country, for people who have cardiac arrest outside of the hospital setting, the survival rate is only about 15%. For areas where there is a high availability of defibrillators and high penetration of CPR skills, that number might reach 30%. There are some areas in this country that are more tuned into that than others. But the only way, like I said, the only way you do survive, even if those chances are not too great, is that someone recognizes you've collapsed and have cardiac arrest and provides bystander CPR promptly, and you get defibrillation promptly. All of that die ends up being cast before those 22 minutes that you're talking about.
Okay. Excellent. And look, I've got to just come back to something that I'm really eager to find out from you. If someone trains excessively hard, for example, they might become like a professional cyclist, and they obviously put a lot of pressure on their heart for a long period of time over several years. Could that be detrimental in the long term in terms of cause heart issues?
I think that's another great question, Ali. It is an area of current interest because I've said, many people will tell you that exercise is good for the heart, but you wouldn't want to overdo it maybe and cause harm, right? So there is always the worry that when a heart problem crops up in someone who has exercised for a long time, one might wonder whether the exercise is what caused the heart problem. It's hard to know. But you talk about cyclists, is who you mentioned there, the long distance cyclists, and maybe the best group of those I can think about would be like Tour de France riders over decades time, or whatever it takes professional cyclists to lead up to that and then participate in the Tour de France. We know that professional riders at that level enjoy a longevity that is greater than the general population. And so my best guess is that cycling, even in that kind of way, is helpful to the body to let you live longer, a handful of years longer than the general population, maybe. So I'm skeptical that exercise is detrimental in the long run. But having said that, I wouldn't say it's impossible for any one individual. But I don't think that the message should be that one should avoid that because you think that it would be safer not to do that. I don't think that's the right thinking.
Okay. And finally, if a client comes to you and says, look, I'm pretty keen to get into exercise, I don't have a lot of time, what one exercise, or I should say type of exercise, and I'll give you some examples, would be the best sort of thing for me to do? Should I just start walking? Should I start running? Should I start doing resistance training? Maybe HIIT? What out of all of those would be the best thing for them to do for heart?
Maybe I would say that we should think about the recommendations from the professional organizations that have given that a lot of thought. So the American Heart Association, the Centers for Disease Control in this country share a recommendation in that regard, and they recommend both aerobic exercise and resistance training of some sort. 150 minutes a week, so 2.5 hours of aerobic exercise that can be simply walking or anything like that might be of interest to the individual. It need not be running. It need not be cycling. It could be anything that raises the heart rate, gets the juices going, and there are many ways to do that, as you might know.
And what sort of heart rate zone are they talking?
Well, the heart rate zone is going to vary depending upon the person and where they start out. And I don't know that there's any easy way to say what's right. But a moderately brisk walk is all it takes to get the benefit here. And maybe that would be the best way to think about it. It needs to be more than simply reaching for the TV remote, which is also exercise, I suppose. But it needs to be a brisk walk would be where we'd put the floor of things, and whatever the equivalent of that would be if you went on a bike ride or you went to swim or cross country ski or I don't know, whatever else it might be.
Okay, so say 2.5 hours of brisk walking, and then what's the amount of time that they would recommend for some resistance training?
So here we're talking maybe in the half-hour range of some resistance training. And again, there's no prescription of what that need be. It could be most anything. It could even be part of someone's work, conceivably. It could be the UPS man who lifts packages all day. It needn't be something at the gym where you're going to go use the free weights, like some of your listeners will think. It can be push-ups at home. It can be pull-ups. It can be something built into life that is not necessarily at the weight room at the gym. I think the weight room at the gym idea is what turns many people off about how to get that part of the prescription done.
So just to confirm then, they're saying 2.5 hours of like some sort of like high level brisk walking and then only 30 minutes of resistance training per week.
That's right.
I wonder if that's going to change.
I don't know. What's interesting in these last two topics we've talked about is that there's a lot of focus on how little exercise one needs to do to enjoy the benefits of exercise, which is what we're talking about now. And that's really the public health problem, right? We need to find a way to figure out what most people should do to get some benefit. And then the previous topic was, is it possible to exercise too much? And that's the part that gets very little attention because very few people are in that circumstance. And maybe that's all right. but it leaves us with questions at the too much end, and a little bit more certainty about what little exercise we need to do at the low end.
So hopefully we've left you some research to do over the next couple of years. So, Dr. Larry, before I let you go, is there anything that you'd like to, I guess, inspire our listeners with, or just even maybe a quote or a little piece of advice that you'd like to leave us with?
What would I say? I'd leave you with the idea that the heart is a simply amazing organ. It is designed to pump blood, beat after beat, hour after hour, day after day, and month and year after year, and for decade after decade. It is a pump like no other pump on earth. And I just suggest that the listeners think to take care of it as best they can, and be in a position to help others if they have troubles with their heart.
Awesome. That's a really great piece of advice. And Dr. Larry, do you have a tattoo?
Do I have a tattoo? No.
Would you, or have you ever thought of getting one?
Haven't thought about that.
So no, I just sort of envisage potentially a heart or something on your bicep.
I have to give that some thought.
Excellent. Look, it's a question we ask all our guests, so thanks for sharing that with us. And thanks again for your time. Really appreciate your advice.
You're very welcome, Ali. Thanks for having me on.
For all the resources and show notes from today's episode, please go to www.ali.fitness. If you liked today's episode, please show your appreciation by going to iTunes, give us a 5-star review and subscribe.